Contraception simply talks about the act of preventing pregnancy.
Okay.
Conception is the act of getting pregnant. Yeah. Contraception, you do not want to get pregnant.
Okay.
So that act is contrary to actually becoming pregnant. So contraception is whatever means that you are able to achieve the fact that you're not ready for a pregnancy, you don't want that pregnancy at that time. So that act of preventing pregnancy is contraception.
Okay. And then what about contraceptives? Is it the medicine itself? Is it the drug itself?
Exactly. So the contraceptives are now the techniques, the drugs, the commodities, whatever means that you're able to prevent that pregnancy is the contraceptives.
You want to add something to what Doctor has said?
She has said it.
You nurses are
I'll just only
add that the administrators of this thing.
I'll just add that it's an intentional use.
Okay.
Somebody must have the intention to use a particular method.
Okay.
To avoid pregnancy.
Okay, it has to be intentional.
Yes.
Okay.
It's not forced on anybody to use.
Okay. So let us take a look at the day. So why commemorate this day? What is special about the day? Why take out a particular day to commemorate the day, to talk about the need for people? Why? What's the essence?
Okay. I think it's the World Health Organization that has set out 26th day of September annually to commemorate World Contraception Day. Of course, because we are human beings, the intention to give birth and be given birth to is there. And I think the reason is we want to create awareness in our homes, in our communities, in our places of work, that though we have that liberty to give birth, but there is need for us to curtail the extent to which we give birth. That is why we say contraception should be something of choice. That's giving birth should be something of choice and not by chance. So we all have the liberty to give birth, but to an extent we should also be able to control the rate at which
we give birth. Do you think we really need to control or control or curtail birth?
Of course, there is need. There is need. If you look at the society, in its entirety, you see that there are a lot of juvenile delinquency. Children are just born by parents. You see people having 5, 6, 7, 8 children, and these are very low class kind of human beings. They don't have jobs. They don't even do anything, but they just give this birth freely. So because you just give birth and you cannot raise those children to a standard, these children will only result to becoming a menace in the society. So that is why there is need, to curtail the number of children we give birth to. Apart from that, you see that every pregnancy presents the woman or subjects the woman to a level of risk. So limiting the number of children that any woman gives birth to also helps the woman to limit the risk that she is also exposed to. So there are so many issues bordering around contraception and the need to actually curtail the number of children we can actually give birth to.
Doc, you agree?
Totally, completely agree. Yes, even the Bible says that all things should be done moderately. We have the ability, God has given us the ability to give birth, and some people will tell you that God said we should go into the world and multiply. Yes, multiply, yes, but you have to multiply to the extent that you can take care of those children, to the extent that you can give them the right parental guidance, and they do not become a menace to the society.
Okay.
So you can imagine, like she said, somebody has 10 children, and you are not available. You cannot take care of those children. You become an absentee parent or an absentee mother or father because you're everywhere out there looking for what to feed those number of children. So you are not really available for them. They become a problem to the society. They become a problem to the community. So we're expected to have the number of children that you can adequately take care of. Like I used to say, some people
while getting pregnant, while the woman is already pregnant, she has already told herself, this particular pregnancy, when I give birth to this one, I will send it to my auntie in Lagos. When I give birth to this one, I will send it to my uncle in the village. When I give birth, so you are just giving birth and just distributing and adding to other people's burden. No, it shouldn't be so. You should give birth and take care of your children. Let the children enjoy that parental love and care from you, not from other people, and most times they end up in the wrong hands and it becomes a problem.
Okay, I want us to reconcile this word now. Contraception, family planning, how do they go together in any way? Is there any relationship? And what is the relationship though?
Of course there is a relationship. Yes, like we said earlier, contraception is the act of preventing pregnancy. Okay. Now in family planning, some people will say, so are you saying we should not have the number of children we want to have? Family planning is for you to be able to plan your family. Plan your family to have children when you are ready to have children. Not just children that come by chance. You have given birth to one, the baby is not up to 1 year, and by the time you are going back to hospital, you're already 3 months pregnant. You have not even completed immunization for the first baby, and you're already 3 months pregnant. Family planning helps you to plan your family. Plan your family according to your resources. Plan your family remembering that that woman, that mother that is carrying those pregnancies, like she has rightly said, has a risk attached to every pregnancy. And there's what we call healthy timing and spacing of pregnancies. Every woman should be able to have at least 2 years.
2 years interval.
2 years interval before she becomes pregnant for the next one.
Is it?
But you will hear some people tell you that.
I was going to ask her if it's really achievable.
Yeah, but it is. It is. Some people who are knowledgeable enough, they practice it and it works for them.
Okay.
And these 2 years we're talking about is not that by the time the baby is 2 years, that's when you're giving birth to the next one. 2 years, by the time the baby you have given birth to is 2 years, is when you should start planning for the next one. So that's how it is. So that you now have this one is 1 year, this one is 3 years, 4 years, something like that. That way you are able, your body has been, you have regained strength, your body is strong enough to handle the next one, and you're able to take care of the next baby. It reduces a lot of stress on the family, on the society, everywhere.
Okay.
I also want to add that in family planning, we do not only, encourage mothers to limit the number of children they can cater for. We also help infertile couples to achieve pregnancy.
I like that because I'm sure people don't even know about it.
There are so many persons who are not aware of how to go about getting pregnant. So many young women don't know anything about their menstrual cycle. So the time they're supposed to get pregnant, they don't even meet with their husband. So in family planning, we sit down, take history, and counsel such couples, to enable them get pregnant. And then if there is need for them to be referred for more care, they are also referred.
Yeah, I think what you're talking about now is the importance of this family planning. So since you've taken us that way, I want you to tell us more. Because I'm sure there's a whole lot of persons don't know that, when we hear family planning, it's to stop me from getting pregnant. Nobody knows that with family planning too, you also have a unit where you can also nurse people to get pregnant. I guess that's one of the benefits of family planning. So basically, what are the other benefits of family planning?
The benefits of family planning are enormous.
Enormous, okay.
Enormous. We have benefits to the mother, benefits to the father,
to the father,
of course, benefit to the child, benefit to the community, and benefit to the nation at large. Everyone gets to benefit from family planning. How? Now to the mother. Let's start from the mother. The mother is able to get pregnant when she's ready, when she's mentally ready, emotionally ready.
I knew you were going to say that.
Of course, because it takes a lot of mental stress to have lots of little children crying here and there, and you don't know how to control it. And that's where you see some mothers end up with depression, which shouldn't be. You end up with postpartum blues.
And some will abuse their children.
And you begin to abuse the children
because they are not happy.
Because they are not happy. So is a baby coming into a family should actually bring joy and gladness, not bring sadness, not bring curses, not bring all sorts of things. So it helps the woman to be able to get herself, and when she's able to plan to have babies when she's ready, she can also, you know, become economically an economic advantage to the home. Okay. So she can, using that time that she has some time space between the next baby and planning for the next one, she can do business, she can work, she can become a support, a financial support to the husband,
and even have a healthy life.
And have a healthier life. Have a healthy life. You don't need to see a 30-year-old that is looking like a 50-year-old because of a lot of stress, because of a lot of pressure. And now to the and then we talk about the fact that when she's able to plan her family, it reduces even some health issues like cancers, ovarian cancers, breast cancers. All sorts of cancers can be reduced even by, you know, planning yourself properly. You know. Then when we talk about the husband.
Yeah, I was waiting to hear that.
Yes, it becomes a huge. The husband can now become like an odugu indeed in the family, because whatever resources he has, he's planning with those resources to handle the number of children he can cater for. He's not being seen outside like someone who doesn't know what he's doing, who doesn't know his left from his right. So he can plan with his wife and say, we want to have 3 children. We want to have 2 children. You see some people have 2 children, a boy and a girl, and they say, oh, we are satisfied. Because they don't want that pressure, that financial pressure. The man doesn't want that financial pressure of today he's borrowing from this bank, tomorrow he's borrowing from this person,
or neighbor, or brothers and sisters.
This neighbor, tomorrow you're going to borrow 1,000 naira to buy a custard of gari, which is not even 1,000 anymore. So, but if you plan yourself, you can, you know, take care of yourself, and it also improves your own self-confidence.
Okay. Our chief nursing officer, I hope I got that right.
Yes.
Let us start with the types of family planning, because usually this is where people have problem. I've had, as a woman, I've had people say, the one they put in the hand, they did like this. The one they did the other side, no be small, oh. The one they put the other one. And then most times you don't ever get to hear whether, you know, a man should also do this. So let us take a look at the types of family planning. Which one can a man use, and you know, more?
Okay, I would like to, you know, describe two major
ones.
Types of family planning. We have the natural method.
Hey, I like that one. What is natural method?
And then we have the artificial method. The natural method is the one that the woman has to know everything about her cycle. You have to know everything about your menstrual cycle.
Sounds easy, but
yes, then you need to also have an understanding with your partner, because without this understanding, things will go wrong.
Yes.
So somebody needs to actually give you a counseling, and you need to, you know, keep record of your menstrual cycle for a period of like 6 months. Wow. You know, for you to actually
be certain that this is how this
can
is
actually work
this what,
or not. Then every other method I'm going to mention now comes under artificial, because this natural, you don't use anything. You don't even do withdrawal methods. You don't use condom. It's just natural. You calculate when you can be pregnant, and then if you don't want to get pregnant,
and it sure works for some persons.
Sure, you avoid those days, and then only go in when you're sure that you're safe. So it's also known as safe period method.
Okay.
Now the artificial method will have barrier methods, which has to do with condom, diaphragm. These ones form a barrier between the woman's body and the man's body. You know, you've heard about male condom, you've heard about female condom.
The routine, then that's how you say it, the routine medicine.
They are not called routine. They are called. They are under.
The oral contraceptives.
No, there is a big name for all of them. Okay, let me say the other contraceptives. You have 2 types. You have the one for
I want to get a clarification on this, because I'm sure that some persons are there. This the one you talk about. I'm talking about the tablets now. Is it the one the lady will have to take it daily?
Yes, I was actually thinking of an umbrella name.
Okay, for it.
For those contraceptives.
No, let's just move on with time.
So we have the tablets, you have two types: the microgenome and the other one is just for mothers that are not breastfeeding.
Okay.
The microgenome is for mothers. Okay, sorry. The other one is for mothers that are breastfeeding. The microgenome is for every other person who is not breastfeeding. Then you have the implants, the ones that are put on the arm through the vagina.
Okay.
That one has both the copper T
and the hormone.
So thank you. So these, all of them form under hormonal, the ones I'm going to mention now. The tablets, the injectables, the implants, they are commonly called hormonal methods. Then the IUD, you have hormonal and non-hormonal. The copper T doesn't have any hormone, but there are hormonal IUDs, that are inserted.
Which one, do you think our women like to use?
They like to use all of these, because it all depends on what your body can take. So when they come, we only make available the list of what we have, and then we counsel them on the available ones, counsel them on the side effects, counsel them on the benefits, and then you allow them to make choice. Now it is only when the choice they have made is contraindicated, probably based on the person's health status. Okay. For instance, a woman is hypertensive, is severely hypertensive, and she wants a hormonal method. Now, looking at her health status, you are bound to counsel her and tell her the disadvantages of what the method she has, that it will, cause.
I will ask you one funny question, because you see, the question is, it also falls under all these myths and misconceptions. Yes. We've had stories of somebody who puts the implants
and the baby comes
out and comes out you know the story. You know the story. So as such things, is it one of the myths and misconceptions, or is there's a fact or truth to it? What do you think?
Oh, well,
because sometimes when you try to convince, that thing is either you are in the field, you would have had
different women.
They tell you, I'm a woman too. Sometimes I put that on. I almost bled to death. I put the other one. One of my sisters, she put the other one. She didn't even know she was pregnant until about 8 months. And when she gave birth with the baby. Then the other injection, I had it and I was still pregnant. So I want you to, unravel some of these mysteries.
All right, thank you very much. That is why you shouldn't take up a method with an unskilled provider.
Okay.
When you go to